My presentation is about preventing falls within the hospital. Change can be scary, and sometimes people tend to shy away from change. But when the things are being changed can be beneficial, more people are willing to actually participate within the change. Falls in general can be devastating, especially to the older population. But falls within a hospital can bring on a whole new challenge and can be detrimental to someone's health. Change can be good, especially when the outcome is in everyone's favor. Fall prevention in the hospital and even after the hospital stay can be beneficial towards everyone's health, including the patient's. Falls are frowned upon because they can increase the length of stay, cause more harm in patients, increase comorbidities, make, like I said, discharge even harder and more complicated. Maybe they need to go home with home health care now. By preventing and implementing fall prevention within the hospital stays can be shorter. What are certain risk factors? Well, falls can happen for all sorts of reasons, but the best way to prevent falls in general is to figure out certain risk factors that lead to falls that happen in the first place. DeGroot and fellows found in a retro case control study that one of the biggest factors for falls is poor balance. When a patient did fall, the patient was nearly 21% more likely to have a lack of balance that played a huge role into the fall. After much research, DeGroot and fellows found that by completing a proper fall risk assessment on the patient immediately during their admission, the patient's balance could be fully assessed. Therefore, the patient could then be labeled as a fall risk, and nursing staff could respond properly. They also found that confusion and hospital delirium also played a role. It's a new environment. Patients don't understand where they are or the certain limitations that are in place. That also being said, MECOS found that certain units, including transition care units and rehab units, have a higher chance of having patients fall. Therefore, they can be on high alert and be aware of the certain risk factors. After an interview done with Renee Sumption, RN, and unit manager, she said that some of the rationale why we need this to happen is falls can increase the amount of testing, treatment, and even longer hospital stays. At the end of the day, that tends to be more money for every party involved. What actions can we take? Well, there's many different actions we can take. First off, just knowing that this is an issue. Being alert and being aware of our patients if they are a fall risk factor. And they have the factors. Early intervention is key. Goldstein and fellows found that when you know who is at risk and you can individualize their care, they have a higher outcome of not having a fall. That also being said, for example, a patient who is admitted for a myocardial infarction, they're known to be one of the greater fall risks. Therefore, nursing staff can be more alert and aware of this. Some of these reasons why is the new medications, the weakening of the body, and even the reconditioning of the patient. Long-term case studies do show that even after 6 months, patient is still at a greater fall than prior to the heart attack that took place. Staff involvement also plays a huge factor in interventions. When you have more staff on the floor and able to answer call lights, provide the patient care, get them that extra water, ambulate them to the bathroom. Carl Lees and fellows found that can be beneficial. The number of falls did decrease. Better yet, having a telesitter from Avasys sit in the patient's room. It's a camera that mounts to the wall or is on wheels in the patient's room to keep an eye on the patient. If the patient's leaning towards the edge of the side to get out of bed to go to the bathroom, they can alert staff. Maybe the patient's confused and doesn't understand or comprehend the fact that the call light would be beneficial. Telesitter System Exchange found that this can be very beneficial. Again, this prevented the falls, and it's almost like a virtual safety attendant in the patient's room. Another big thing is having the collaboration of care within patients. The interprofessional collaboration all gets together for one outcome: prevent the patient from falling. Some of these include physical and occupational therapists. Van Coast, McCanna, and Glenn Meyer found that having physical therapy and occupational therapy within the team for the patient's care, they can improve the patient's balance, gain more strength, and even work on the gait training. Again, this all prevents the patient from falling. Leverin and Lape found that NCAs also play a role in this interprofessional collaboration in the care team. They're the ones who provide the direct patient care more so than the nurses. This care includes walking them to the bathroom, making sure they have a water at bedside so they don't feel the need to get up and become impulsive. Lastly, patient placement. Venma and fellows found that if you're able to communicate with the placement team within the hospital setting and making sure if the patient is a high fall risk, the biggest thing is maybe see if they can get a room closer to the nurse's station to be that extra set of eyes and ears if the patient is becoming impulsive or might need something or anything that might lead them to being a fall risk. Lastly, the most important thing is implementation of the fall prevention program. These findings are all something that we know about but maybe don't have in the front of our mind. Something that we put in the back of the mind because we're busy passing meds or making sure they get to their test on time. But at the end of the day, none of that can be possible if this program was not in place. We've all heard of the call, don't fall. Well, that's great and all, but if you're confused, how are you going to remember to call? By having some of these interventions like more staff on the floor, the use of the AVASIS cameras, even having physical therapy and occupational therapy work with the patient to make sure they are strong enough to even get out of bed. All these interventions within the hospital, they're there to decrease the falls. Identifying a patient's fall risk is priority. It should happen quickly within the admission. Educating the patient and family on the interventions can also be beneficial. Last but not least, having the AVASIS telesitter available is one of the best things that can happen for that patient.